At some point, you may have wondered if you might be vitamin D deficient, and for good reason. A 2023 analysis looking at nearly 8 million people found that between the year 2000 and 2010, about 77% had vitamin D levels below what's considered normal. And in more recent years, that number remains around 75%. So why does this matter? Low vitamin D levels have been linked to conditions like cancer, autoimmune disease, and infections. It's not entirely clear whether low vitamin D is the cause of these conditions or a result of them. But either way, it's something we should take seriously. In its active form, vitamin D helps your intestines absorb calcium, super important for bone health. Without enough vitamin D, your body only absorbs about 10 to 15% of the calcium you eat, compared to about 30 to 40% when levels are adequate. That's a big difference. Low vitamin D affects bones differently depending on age. In children, before their growth plates fuse, it can lead to rickets, observed as soft, weak bones that can result in bowed legs. In adults, after the growth plates have fused, it leads to osteomalacia, which causes bone pain, muscle weakness, and an increased risk of fractures. The risk of vitamin D deficiency increases with age, darker skin pigmentation, conditions that affect absorption in the gut, and chronic kidney or liver disease. It's also more common in people with limited sun exposure. Studies have shown that vitamin D levels vary significantly based on how much sun exposure someone gets, whether it's regular sun exposure, occasional sun exposure, or avoided altogether, and tend to drop during the winter months, when people spend more time indoors. So how do we get vitamin D? Our bodies produce it in the skin with the help of sunlight. UVB rays convert a cholesterol called 7-dehydrocholesterol into vitamin D3. That vitamin D3 then travels to the liver, where it's converted into 25-hydroxyvitamin D, which is the main form we measure in blood tests. From there, it goes to the kidneys, where it's turned into its active form called calcitriol. Safe to say that the sun has a major role in the production of vitamin D in your body. Since sun exposure varies depending on where you live and your lifestyle, it's important to look at other sources of vitamin D. You can get vitamin D from foods like fatty fish such as salmon, sardines, and tuna, along with eggs, mushrooms, and fortified foods like milk or cereal. If you're vegan, fortified plant-based milks can be a good option, and if needed, supplements are widely available. For most people under the age of 70, the recommended daily intake of vitamin D is about 600 international units, and for those over the age of 70, it's about 800 international units, based on guidelines from the Institute of Medicine. However, in 2014, some researchers reanalyzed the data and suggested that much higher intakes, up to around 8,000 international units per day, might be needed for nearly everyone to reach optimal levels. The challenge is that this amount exceeds the generally accepted safe upper limit of 4,000 international units per day. While higher doses are sometimes used in specific situations, they're typically prescribed only short-term and under medical supervision. For now, major organizations like the Endocrine Society continue to support more conservative, standard dosing for most people. That said, more is not always better. Too much vitamin D can raise calcium levels in the blood, leading to symptoms like muscle weakness, frequent urination, kidney stones, constipation, vomiting, and even heart rhythm problems. So while vitamin D isn't always routinely checked, it may be worth discussing with your doctor, especially if you have risk factors or concerns. Based on your levels, they can guide you on whether you need supplementation and how much is right for you. Thank you for joining me in this video. Please subscribe for more medical tidbits.